Hi, my name is Dr. Moreno. I'm an osteopathic physician here at Center for Wellness, and I'm excited sharing with you about vitamin D3. In the past, we thought that vitamin D3 was only related to bone health, but now there's many studies showing that vitamin D3 is essential for sleep patterns. It's essential for immune system. It helps with many things beyond the bones and our health. So the simplest way to increase your vitamin D3 levels is obviously healthy nutrition and being outdoors. The best time to be outdoors and have skin exposure is between 11 a.m. and 3 p.m. So those are the best times to be outdoors. And usually we recommend starting off with 20 minutes. If you're already doing 20 minutes, then increase to 30 minutes or increase to 40 minutes. Obviously you want it not burn. You don't want to have a sunburn. So if you start off slow and build up, our bodies make vitamin D3 by having sun exposure on our skin. Our skin is an organ, and the rays of light stimulate vitamin D3 production. And again, this is a simple thing that we can do to help our bodies function. If you can't be outdoors between 11 a.m. and 3 p.m., then you definitely want to be including vitamin D3 in your supplementation. We recommend checking your blood levels. Ideally, we like to see our patients' blood levels between 60 and 80. That's on the higher range of normal. Again, the studies showing benefits to the immune system when patients have blood levels of 60 to 80 in there, they seem to do better in terms of avoiding illnesses like severe flus, colds. There's even studies showing a correlation to cancer. So again, vitamin D3 is essential. We can make it, by being exposed to the sun, or you could take some. I definitely recommend having your doctor measure your blood levels of vitamin D3, and the goal again is between 60 and 80 in your blood. Again, is there's too much? If you're getting your vitamin D3 from sun exposure, your body's not going to make too much. Can you take too much vitamin D3? It's very rare, but it can happen. I've seen a patient's blood levels over 100. If a patient's blood levels is over 100, I just tell them, hey, stop taking any D3 for a little bit, get them back in between 60 and 80 range, and then they could maintain the supplementation. Most people are deficient in vitamin D3. Again, you think about evolution. We've been outdoors, exposed to the sun for millennia. Now most of us are indoors. We're not exposed to the sun. So you want to be taking some form of vitamin D3. If you're deficient, we'll give patients 5,000 international units, 10,000 international units. We've given patients 20,000 international units. So it really depends on what your blood levels are. If you don't know your blood levels, it's safe to take 1,000 international units. Sometimes that's too little. It's not going to make a difference. So we highly recommend measuring blood levels of vitamin D3. The other thing I want to say about D3, if you are using the sun as the stimuli to make vitamin D3, the darker skinned you are, the more sun exposure you have. So I'm not too light, not too dark. So I'm going to need, let's say, 30 to 40 minutes of sun exposure to get my regular sun exposure to get my vitamin D3 levels to a normal level. If you're darker, you're going to need a higher, more time exposure in the sun, or possibly more vitamin D3 intake. the lighter skinned you are, the less time you need in the sun. So that's another factor that influences our vitamin D3 levels, is your color of skin. I do want to mention two studies. Again, this is the time of COVID. We're in June of 2020, and there were two studies showing a relationship between vitamin D3 levels in the blood to severity of illness. So one Grassroots Health did both of these studies. They compared different patients' blood levels to severity, again, of COVID illness. And the higher your blood levels of vitamin D3, the lesser severity of, if a patient did get COVID infection, their symptoms weren't as severe as somebody that had really low levels, let's say 20 or below of vitamin D3 levels. And the patients that did have lower blood levels of vitamin D3 tended to have more severe infection and even mortality. In Sweden, there's less than 1% Somalians. So Somalians have very dark skin. What does that mean? They need to be exposed to the sun more than somebody who's lighter, right? And so Sweden, 40% of their deaths related to COVID were Somalians. Now why? Because their levels are going to be lower. They're not getting the sun exposure. Sweden's very north in North Europe, so you're not going to get the same sun exposure. So even if you are outdoors, you're not going to get the same stimuli to make vitamin D3. So again, color of skin, blood levels of vitamin D3, and severity of illness. Those are all tied together. So the bottom line is, make sure you're taking a vitamin D3. Ask your doctor to check your blood levels of vitamin D3. And again, have fun in the sun and expose yourself to healthy levels of sunlight. Again, this is Dr. Moreno. Thank you so much for watching here at Center for Wellness. And please come back and ask questions. And we love to interact with you. Thanks again for watching. Bye-bye.